My name is Amy Neufeld, and this is Ivor, our wonderful peritoneal dialysis nurse, but today he's our patient. So we're going to take you through the steps of doing a peritoneal dialysis exchange and show you how to do each one so that you too can do peritoneal dialysis for your renal patients. Step 1, warm fluid and explain procedure to patient. So I have my fluid warming in here, 1 bag of lactated ringer and 1 bag of D50 in hot water. This is my patient. Good morning.
Yeah.
How are you?
Fine.
Good. You have had this procedure done before, correct?
Yeah.
Do you have any questions about it? Okay, wonderful. So he has had this done a few times before, so I'll not go through the explanation with him. Step 2, place surgical mask on patient and self. Draw curtains and ask any caregivers to leave until exchange is finished. So we have the curtains drawn. If we're at a bed with many beds beside, we draw the curtains in between to prevent infection from other patients to reach the site so that it's keeping it more sterile. Patient, please can you put your mask on?
Okay.
Thank you. And I will put my own mask on as well. But for this demonstration, I will leave my mask off so that you can hear what I'm saying. But I would normally put it on now, and I would keep it on for the rest of the procedure. Step 3 is to wipe bedside table with alcohol. So this is our alcohol. I will squeeze some on and wipe it so that we have a nice clean surface for everything that we will do. Step 4 is to wash my hands with soap and water. Alright, so this is our package of sterile towels. Our next step is to place 1 sterile towel under the PD catheter. So I'll open it, being careful to maintain sterile technique. And being careful to take only the edge. And I'm looking again for the edge because I don't want to touch it in the center. That will contaminate the field. And I will place it underneath. So because this catheter is not sterile, this drape is no longer sterile, but it helps to decrease infection at the site. Step 6 is to place the second sterile towel on the bedside table. So again, being very careful to take only the edge. And if I shake too strong, then I will touch the wrong part. So I'm always careful to touch only the edge. And not to reach across either. Step 7 is to place the items on the table that are listed. So first I will place the sterile bowl. Then I will place 4 pieces of sterile gauze. And 2 sterile swabs. And 1 sterile forceps. This one I will place at the edge because I will be using the handles to continue setting up the field. So the handles will not remain sterile, but the tips need to remain sterile. Lastly, I will add 1 piece of sterile gauze, large enough to cover the sterile bowl. We will use it later in the procedure. Next is to add the items in packages onto the sterile field. So I always take some alcohol and I like to clean the scissors before I cut the packages open. Step 8 is to add the items to the field. So I will add my fluid. It has been dried from the water. I will cut at the top. We do not want to rip the packages open because then they are more likely to cause contamination. And then I will use my forceps to take out and add onto the table. Being careful that it remains in the center, because if it is not in the center, then it will be contaminated from the edges. So that's my lactated ringer fluid. Next will be my D50 fluid. And then my infusion set. And my urinary bag. Next, we have to take our syringe. This is the towel that was used for the previous exchange. So inside, we have kept the syringe and tried to keep it sterile as possible. So we'll open it up. And use our forceps to remove it and place on our sterile field. And then we can discard this towel. Next, I will add, this is step 9, I will open the container with the alcohol. And step 10, I will take my forceps and remove from inside 1 stopcock, which is a new stopcock for each patient, but then we reuse between exchanges, and place it in the bowl. We place it in the bowl because if we place it on the towel would become wet. And when the towel is wet, it is contaminated. So we put it inside the bowl. And we also put the suction tubing inside the bowl. When everything is ready, we want to make sure we clamp the PD catheter before we get our sterile gloves on. Step 11 is to put on my sterile gloves. You don't want to use this space because it's all sterile. So often I will use the patient's bedside or an extra table if there is space. So being careful to touch only the inside part, not the paper and not the part that will be outside that will be sterile. Put my first glove, and then again, being careful to touch only the sterile part, not the part that will touch my hands. Okay. Next, we'll use the syringe to remove the correct amount from the lactated ringer's bag that we are going to add of D50, so it is the correct concentration. Since it is already sterile, we do not need to swab it. So once you have the fluid from the lactated ringer, you'll discard into a kidney basin or into the bowl that you use for heating up the fluid. And then you will draw up the D50. Now I have my D50 in the syringe, so I will add it into my lactated ringer. Then you can recap the needle and keep it for the next exchange. The syringe needs to be changed every 24 hours. So usually the first exchange of day shift, you will take a new syringe. Next is to connect the dialysate, the lactated ringer, which you have rotated, to the infusion set. First making sure that the clamp is closed. And then we will pull this tab. And connect. Again, being cautious of the edges. Next is to attach the infusion set to the stopcock. We want to make sure to connect it to the correct port. Next is to attach the suction tubing to the urinary bag port of the stopcock, which is the one on the bottom. It's important to try to get this as far as possible, even up to the center if possible. Sometimes there will be leaking from this site, and it means that it is not on well. So we really need to make sure that at this stage we get it all the way there. Next is to attach the urinary bag. You want to make sure the bag port is closed, and then connect from the urinary bag to the suction tubing. Then we will turn the off towards where the patient will be. Next, we will take 2 pieces of gauze and come to the catheter. With one, we will hold the catheter. With the other, we will remove the cap and place the cap in the alcohol. Next step, while we are still holding the catheter, don't let it go, is to swab the port. So we will take our swab, dip it in the alcohol, and swab, beginning with the middle, and then we will come around and allow it to dry. Next, we will connect the stopcock to the patient. Then we will take our dialysis fluid, and we want to be careful of our hands now, especially this one has touched the catheter, so it is not sterile anymore. But we will take the fluid, and if we have 2 bags of fluid, we will take them both. And I've prepared a hot water bottle here. So I will wrap them by the hot water bottle so that they will stay warm while the fluid is draining. Next is to begin the drain cycle. So our urinary bag should be on the floor. We like to put it on the wrapping from the sterile gloves, just so that it's not directly on the floor. And then we will turn our off towards the infusion set and take off the clamp. Then we will make sure that the dialysis fluid is flowing well into the bag. Then we can remove our gloves. They are no longer sterile. Put them in the garbage and clean our hands with alcohol. Next, if we are reusing our syringe, then we can arrange the table while the fluid is draining. We can arrange things so that we can close the sterile field. So we can remove our glucose will be empty, our D50 will be empty if we are doing a large amount. We can remove it. We're still trying to keep the tips sterile, so we'll remove that. We'll remove these, any other things that are on the field. With this, we can remove the bowl and place on the bedside table. We will use it again later, so make sure that it stays sterile. After the bowl is on the bedside table, we will cover it with the sterile gauze and allow the forceps inside so that all will remain sterile for when we remove the cap. Then we will close up our sterile field so it is just like the one before that we opened, ready for the next exchange. Next is to reposition the patient from side to side if needed. And we want to make sure that all of the fluid is out of the abdomen. We will palpate to make sure If anything more is coming out, you'll maybe turn them and allow it to drain. And once it's finished draining, not more than 1.5 hours, then, or whatever your hospital policy is, you will make sure that there is enough fluid in there that is more than is infused. Once draining is finished, we will prepare to begin the fill phase. So you'll clean your hands with alcohol or wash them. You'll hang the fluid up nice and warm. Fill the chamber. Okay, and then before we come to the stopcock, I will clean again and put on clean gloves. Then I will turn the stopcock off towards the patient. I will open the infusion set roller clamp until fluid comes down all the way to the stopcock. This is called flush before fill. It is to flush out anything that may be in the stopcock from draining or anything that is in the line. So it will flush down and out into this part, into the drain bag instead of into the patient. Next, we will begin the fill phase. So we turn the stopcock off towards the drainage bag, and then we open the roller clamp, making sure to open it to the correct amount that it should be flowing well and that it will finish in the correct time. If you are using 2 bags, when the first one is finished, you will again clean your hands and put clean gloves. When you remove the spike, you must be very, very careful when you remove it not to touch the spike or contaminate the port on the new one. Then you will remove the guard on the new one and insert the spike again to the new bag. And then open to continue filling. Just before the fill phase is finished, we need to prepare by removing the cap from the alcohol. Open our alcohol and remove, using our sterile forceps, remove the cap from the alcohol. And place into the bowl. Next, we will make sure the roller clamp is closed. We will apply the clamp again to the PD catheter. Then we will put on our sterile gloves. Next, we will take the 2 remaining pieces of sterile gauze and disconnect our assembly from the PD catheter. Next, while maintaining one hand on the catheter, we will again take our swab, dip in the alcohol, and then swab, beginning with the middle and then going around. Then we will take our cap, being very careful not to touch the end that connects to the catheter. Then we will take our assembly, we will disconnect everything, put our suction apart from the stopcock. Do not leave them together. We need to clean in between. So the suction goes inside. The stopcock, we must turn the off to the side, pointing to nothing, because that way the fluid can get in all of the ports to maintain sterility, and then it goes inside also. Lastly, we can discard our empty bag and all of our tubing and make sure that we measure our dialysate fluid that has come out from the patient with a graduated cylinder or a urinal before discarding it. Now that everything is completed and the catheter is again capped, we can remove the clamp if it's an external clamp, or if there's a clamp on the line, we can leave it clamped. And then, since everything is closed, I can remove my mask and the patient can remove their mask. You can remove your mask now. Thank you.